So the idea of the healthy settings approach is to try and have a much more sustained approach to community development, where people identify their own priorities. Those priorities are representative of the whole demographic group within the community, and then they find ways through their own resources, through stakeholders that they interact with, and through their own expertise to address the needs that their communities have.
For us to reach the sustainable development goals, we really need to involve the community with this health setting where all sectors it's a cross-sectional approach of health setting at the health facility level as well as at the school level and at the market level.
7.
We have something called a shoot scale. Basically, it's a tool that can be used by any literate or illiterate person to demonstrate how important and how satisfied they are with different elements in their lives and identify which one of these should be addressed first.
So people raised general issues. We didn't have a specific topic which you asked them. We asked them how their daily lives are.
Kodi muziwaje mkole muli zinthu za mtundu zosiyana-siyana. Kodi muli skulu, muli chipatala, muli nkhalango. Zonsezi tinazigamba mamapo athu amuzino waje mkole.
We have 18 villages. And in the community section, we work with specific committees called village action groups, representing the whole population.
We break a community into 6 demographic groups. We have leadership, men, women, youth, male and female, and the elderly and marginalised groups as well.
Even the different groups had different priorities. All these were compared, and we exactly knew what the communities felt were their challenges in regards to health and daily life. It's not common that the youth work together with the elderly in that area. It's not common that the disabled and the leaders all come together and make priorities and look at the problems facing the community.
Mwene okhuza naona kuti poyamba ndimangudikira kuti kakubwera kuboma kaya amabungu kuti azangu tipesa kuti atikupenganiza kuti zakuti mara vantu zoti taza kuti tokhatha kutani takumapanga ndi umwini.
We had intensive capacity building and enlightenment on how it is not the responsibility of anyone to help them, but it is up to them to bring change to the society, to their communities on day-to-day problems they face. So with those discussions and also current situations they're going through and how they have stayed with problems for years, this convinced them that somehow they could do something on their own.
Ndakhala osinthika kwambiri kumbali ya chitukuko. Ndinali munthu ongoti ndimangowauza anthu kuti akuluakulu ndimangolamula panganicha akuluakulu ine phe njeroazi tayamba ngati za Nazareth School komano masomphenya athu akufuna kuti tikwaniritse class 1 mpaka 5. Komiti ya panjigo iyi yangochoka kumaphunziro kumene kapena kuti ku skulu kumene.
Tachoka kumaphunziro petera zona kuti no njimazi awawa sitingangotaya tikufunika kuti mazi amene adagwise ntchito kuti apindulire. Chonga ya masamba amene choti tipese ndalama zimene tingathe kugulira ma spares athu a njigo athu.
Chitukuko sichingakwere ya koma ife tifuna kuti chitukuko chikwere nde ineyo sindiyenera kungokhala komanso ine ndizikhala ndikujijilika nawo tolinga chitukuko chikwere mudzi wathu utukuke.
Ndikuona ngati imbikisa njira kuti makamaka pa zaumoyo mwana wina aliyense akuziwa amene zaumoyo zimayendera komanso malo modelezi anasankha tsogolo labwino kwambiri kuti ali ndi moyo wokwaniritsa chisankho chawo cha moyo wawo.
People at home, they can learn this because of these learners who are being impacted with these knowledges here at this school. Then when they go home, they teach their friends, they teach their mothers, their parents. They are now happy because the disease of diarrhea, whatever, are now minimized in the village.
Say this project has inspired us. With their coming itself, it has enlightened us in so many ways. I mean, the issues that have been on the ground itself, they are really genuine. The issue of self-empowerment. We shouldn't just be depending on other people. These are the issues that at least we have learned from this one, from this project itself. That has at least sharpened us in one way or the other. Girls were dropping from school because of pregnancy. But now, with the coming of this Chikwawa initiative program, the pregnancy rate has dropped down.
The learners themselves need to take an initiative. They need to be empowered to have a chance to say no. So they introduced Girls Club in the schools. They discuss how can maybe you are forced to go into marriage. How can be the best way to address that?
Nsikana kaka mu club imene yoyo amatha kupanga improve ma grade zake, amatha kukwera mwina ngati analotsika pa maphunziro amatha kukwera maphunziro komanso amakhala mu high self esteem. Vuto limene lakhala kwambiri kwa ine ndoti anyamata amabwera kwa ineyo mazana kuti palibe amene tinaona akazi akuphunzira mkazi samaphunzira koma chifukwa choti ine ndi Girls Club ndimakhani timotifoda anatizo zoti tingathe kufe kupanga chinthu ndimawazo zona kuti ineyo ndizata ngati pasala anthu amene sanati ine ndizakhala oyamba kuti kukwanisa.
If the schools are healthy and maybe the markets are not, it means we won't achieve anything. So as we are doing with the schools, the same approach is also being done in the markets. We're trying to build capacity in the stakeholders around the market too, to also take responsibility on issues around the market.
This market was a dirty market. Flying everywhere, and there's no any healthy thing in this market. But now they come to teach us how we can make our life to be healthy. This time, our market is looked very clean. We drink water, healthy water, and you give us a toilet, a good, very, very good toilet. Anyone can take a part. That is our luck here at Pokono.
You are empowering the community to find their own issues, and you are empowering the community to realize their own potential, to come up with solutions for their own problems. So that type of approach to the community was very special. The project has done a lot. At first, we had a hospital with poor roofing, whereby we had all wet when it rains. And also, the staffs themselves. We have been trained in various aspects. Like we had customer care training, where we were trained to be very good health personnel when it comes to assisting patients. We also got trained in family planning issues. Because of the youth-friendly health service training we conducted, and because of the awareness meetings we have been doing in the communities, now our youths have realized that they have the chance to come whenever they want, so that they should be assisted according to standards. Every group village headman has set up a youth club. So in these youth clubs, the HSAs go around. The youth are now more open than before. It means in their debates, they are discussing issues which seem to be kept secret in the past.
Tikakumana zomwe timakambirana monga ife ya Chinyamata timakambirana zolimbikitsa za usogolo wabwino kapena uchembere wabwino.
Pamene monse tinalibe ne pagulu sinikadziwa kuti matenda angapera bwanji.
Komanso munthu kakhaula apezeka mu youth club umakhala manyazi ulibe kumakhala kuchotsa manyazi.
kapena kuti nditapanga zini ngatenge mimba sininkadziwa koma sinditapita kugulu zinambondithandiza.
The long-term goal of healthy settings approach is to produce healthy communities which can sustain change, communities which can identify their own priorities, and they then are able to look at how they can address them and address them themselves and with stakeholders and partners.
This is the first of its kind, so we feel this might actually be benchmarking to make sure that we can roll it out to other districts as well as to other regions within Malawi.
Health doesn't work in isolation. It involves the economic status, agriculture, food security, all these affect health. So having the village action group in the community to coordinate all these priorities as one goal has been a significant experience for the communities working together in various demographic groups, because everyone has a voice now.